This is part 2 of how to read cardiac rhythms. I want to show you that it's not as hard as you think. So the very first thing is we start out with a 6-second strip. Whenever you see these, you need to think these are 6 seconds. But there's 3 waves within this cardiac strip that I want to show you. It's the P wave, the QRS, and the T wave. If you have these 3 waves, you have what's called a sinus rhythm. And when you think about these waves, you need to think P wave equals atrium, QRS equals ventricles, and the T wave is like the recharge, saying, hey, let's do this all over again. This will come in handy later, so keep this in mind for part 3 when we start looking at deadly rhythms. But let's look at this rhythm strip again. We have a P, a QRS, and a T wave. And remember, it's a 6-second strip, so you can count each of the QRSs and get your rate per minute. So let's go ahead and count those. We have 1, 2, 3, 4, 5, 6, 7, 8. That means it's about 80 beats per minute, which means we have a normal sinus rhythm. I say normal sinus because you have a P wave, you have a QRS, you have a T wave, and it's within that 60 to 100 beats per minute, and it's not an irregular rhythm. So that makes it normal sinus rhythm. You know that if it were less than 60, we would call that sinus bradycardia, or greater than 100, you'd call it sinus tachycardia. Let's just look at those real fast while we can. You see we have a P, a QRS, and a T wave, and it's 1, 2, 3, 4, so about 40 beats per minute, so you'd call that sinus bradycardia. Whereas down here, you see you have a P, QRS, and a T. They're a lot closer together because it's 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13 in that 6-second strip. So it's about 130 beats per minute, and we call that sinus tachycardia. Like and follow for part 3, where we start to look at some more complex rhythms.